Imagine a scenario where the threat of widespread flu isn't just a seasonal nuisance, but something that could overwhelm hospitals. This is exactly what we're facing this year. And here's where it gets controversial. Health experts are emphasizing the urgency of getting vaccinated, because the flu's impact has been more intense and occurring earlier than usual. To combat this, additional NHS walk-in clinics are being set up across Cornwall to bolster our defences against the flu. Specifically, NHS Cornwall and the Isles of Scilly announced that these extra clinics will operate from December 15th through December 18th. Their aim is to increase access to flu vaccinations, especially since NHS England recently reported startling statistics. An average of 2,660 patients per day were hospitalised last week due to flu, the highest figure for this time of year in history, representing a significant 55% increase compared to the previous week. According to Dr. David Strain, an associate professor at the University of Exeter Medical School, the specific strain of H3N2 influenza, known as subclade K, has arrived roughly 2 weeks earlier than in recent years. Despite early concerns, he reassures the public that there is currently no evidence suggesting this strain causes more severe illness. Still, the rapid rise in infections has raised alarms. And this is the part most people miss. The circulating virus this winter is a particular version, H3N2 subclade K, a subtype of the seasonal influenza A virus. The University Hospitals Plymouth NHS Trust has issued what they are calling a last chance call for residents to get their flu shots before Christmas, highlighting that the number of flu-related hospitalizations in the southwest has drastically increased, from an average of 79 admissions per day at the end of November to 139 per day in early December. Dr. Strain mentions the term super flu, which has sparked some concern among the public. However, he clarifies that the earlier surge isn't necessarily a sign of it being deadlier, but rather because the virus has undergone a mutation, making it somewhat different from previous strains. This mutation means that natural immunity acquired from past infections might no longer be as effective, contributing to the quicker rise in cases. He stresses the importance of vaccination, urging those who are eligible to get their flu shot as soon as possible. Since it takes about 10 to 14 days after vaccination for immunity to develop fully, getting vaccinated now could significantly impact reducing the peak number of cases and easing hospital pressures when the flu reaches its height. So, with the flu season intensifying earlier than usual, the question remains: are you doing enough to protect yourself and your loved ones? Do you agree that vaccination is the best defense, or might there be other strategies? Share your thoughts below. This debate is far from over.